Are you over 70? Then take a few minutes to listen, because this might help you avoid unnecessary trouble. Many people believe that the more often you get health checkups, the safer you are. But the truth is, after a certain age, some common tests may bring more risks than benefits. They can lead to unnecessary treatments, complications, and even a reduced quality of life. According to new research, nearly 1 in 3 tests given to older adults result in unwanted side effects. And what's more concerning, the majority of people over 70 are never warned in advance. In today's video, we'll share 4 types of medical tests that seniors should think twice about before undergoing. You'll hear real-life stories, clear scientific data, and most importantly, safer alternatives. If you want to stay healthy, in control, and free from unnecessary worry, this video is for you. 1. Colonoscopy. If you're over 70, especially over 75, this is one health screening you should seriously reconsider: the colonoscopy. For many years, colonoscopy has been considered the gold standard for detecting colon cancer. It allows doctors to directly view the colon and remove any polyps if found. Sounds great, right? But once you pass age 70, the balance between benefits and risks starts to shift in the wrong direction. The reason is simple: your body no longer reacts the way it used to. Preparing for a colonoscopy, especially drinking strong laxatives, can lead to dehydration, electrolyte imbalances, and even kidney failure in older adults. On top of that, anesthesia used during the procedure can cause dizziness, irregular heartbeat, and temporary memory issues. That's not all. The risk of physical complications, such as intestinal perforation and bleeding, increases with age, especially if the doctor tries to remove a small, harmless polyp that didn't need removal in the first place. A major 2019 study tracking over 1.3 million Medicare patients found this: for every 1,000 colonoscopies in people over 75, only 2 lives were actually saved, while over 20 people experienced serious complications. That's a risk 10 times higher than the potential benefit. So the question is, are there safer options for older adults? The answer is yes. One of the most effective and safer alternatives is the FIT test, fecal immunochemical test, which can be done at home. It's simple, requires no difficult prep, no anesthesia, and can detect hidden blood in the stool, a possible early sign of colon cancer. FIT tests are highly sensitive, low cost, and have virtually no side effects. Many modern doctors now recommend that people over 70, unless they have symptoms like unexplained weight loss, rectal bleeding, or a family history of colon cancer, should opt for stool testing instead of a colonoscopy. Health is not about doing more, it's about doing what's right. After 70, wisdom is choosing well, not doing everything. 2. Full body CT scan. It sounds appealing: one scan to check your entire body, detect cancer and dangerous diseases early, before they have a chance to develop. That's the promise behind many full-body CT scan packages, especially in high-end clinics offering executive health services. But the reality behind that promise is far more concerning. The first thing you need to know is this: a single full-body CT scan exposes your body to an extremely high dose of radiation, equivalent to about 500 chest X-rays. And that's not harmless. A 2023 study published in JAMA Internal Medicine revealed that overuse of CT scans in the U.S. may contribute to up to 5% of all cancer cases, similar to the cancer risk from drinking alcohol daily. Even worse, CT scanners are incredibly sensitive. They can detect tiny, harmless abnormalities, like small lung nodules, benign calcifications, or fatty spots in the liver, all of which are common as we age. But the moment a suspicious spot is found, the medical machine kicks into gear. More tests, PET scans, biopsies, and sometimes even surgery. The result? You're not just facing high costs and emotional stress. You could also suffer real harm, complications, or hospitalization from something that didn't need intervention at all. Take the story of Marcus, an active, healthy 80-year-old who still teaches martial arts to seniors. After signing up for an executive health package, doctors found a tiny spot on his lung. Following a string of scans and a biopsy, the result came back benign. But during the biopsy, he suffered a collapsed lung and had to spend nearly 2 months in the hospital recovering. All from one unnecessary CT scan. The takeaway is clear. If you don't have clear symptoms like sudden weight loss, coughing up blood, or persistent unexplained pain, you don't need a full-body CT scan. Searching for disease in an otherwise functioning body is like using a landmine detector to hunt for treasure. You might find something, but the cost could be far too high. Listen to your body. Only test when truly necessary. 3. DEXA scan, bone density scan. Have you noticed a bit of a stoop in your posture? Or maybe your doctor suggested a bone density test, known as a DEXA scan, to check for osteoporosis? It may sound reasonable, but after age 70, this test could potentially do more harm than good. Why? First of all, bone loss is a natural part of aging. That doesn't mean you're sick, but when you take a DEXA scan, small age-related changes are often misinterpreted as osteoporosis. As a result, many people are labeled with a medical condition that may not require any treatment at all. So what happens next? Your doctor may prescribe a class of drugs called bisphosphonates, often marketed as a way to prevent fractures. However, the reality tells a different story. Studies show that for women over 70, these drugs reduce fracture risk by only about 0.3% of years. That's a tiny number, almost negligible. Meanwhile, the side effects are far from negligible. Jawbone necrosis, leading to tooth loss and long-term pain, acid reflux, and esophagitis, very common in older adults. Bone pain and muscle weakness, making mobility even harder. So if you're not going to do a DEXA scan, what should you do? The good news? There are natural, low-risk, and highly effective alternatives. Eat calcium-rich foods like almonds, dairy, kale. Supplement with vitamin D, especially if you get little sun exposure. Engage in gentle daily exercises, walking, light weightlifting, and balance training. Studies show these methods can reduce fracture risk by up to 20%, far more than the effect of medication, and without any severe side effects. Bottom line, if you're over 70 and have no specific symptoms, think twice before getting a DEXA scan. Sometimes listening to your body and choosing wisely is better than chasing test results. 4. Cardiac stress test. Many people over the age of 70, after feeling just a little tired or noticing a faster heartbeat, are immediately advised by doctors to undergo a cardiac stress test. But did you know that at this age, the false positive rate for this test can be as high as 40%? This means that out of every 10 people over 70 who take the test, 4 receive false warnings about heart problems, even though their hearts are actually healthy. The issue is that once an abnormal result is reported, you may be drawn into a series of unnecessary procedures, from coronary angiography to stent placement and even heart surgery. These procedures come with significant risks: internal bleeding, kidney damage from contrast dye, post-surgical complications, and in many cases lengthy hospital stays, all because of a false result. So when is a cardiac stress test truly necessary? Only when you actually have clear symptoms, such as chest pain during activity, shortness of breath while walking lightly, or unexplained fatigue. In such cases, the doctor may then recommend further testing. In most situations, a resting electrocardiogram, EKG, is a simple and safe method to evaluate your heart's rhythm. For those with higher risk factors, a coronary artery calcium scan, calcium score scan, is a more accurate and lower risk option than running on a treadmill to stress the heart, as required in traditional stress tests. Advice: if you feel healthy and don't have any obvious symptoms, don't rush into a cardiac stress test. Instead, ask your doctor, "What is this test for?" If the result is positive, what's the next step? These questions are your best defense, not just for your heart, but for your overall safety. Don't get tested just because it's available. Get tested because there's a reason. As we enter our 70s, many of us begin to feel more anxious about our health. That's perfectly normal. But this anxiety often leads people to rush into a series of medical tests, simply because they believe that prevention is better than cure. The reality, however, is not that simple. Not every test helps detect diseases early, and not every test saves lives. On the contrary, some screenings carry significant risks, especially in older adults: perforated bowels, kidney damage, internal bleeding, even irregular heart rhythms caused by anesthesia during what seems like a harmless colonoscopy. The most important thing is to stay alert and informed. Before agreeing to any test, ask your doctor or yourself, if this test finds something, what's the next step? Do I really need treatment? And could that treatment be risky? For example, many false positives from cardiac stress tests have led to unnecessary stents and even heart surgeries. The result? Patients face bleeding complications, kidney damage, and extended hospital stays, when their hearts were perfectly healthy to begin with. Prioritize tests that truly benefit you. We're not denying the value of medical screenings, but instead of doing them indiscriminately, you should choose carefully based on clear symptoms. If you don't have chest pain, shortness of breath, or digestive issues, then testing just for peace of mind might do more harm than good. Safer alternatives like the fit stool test instead of a colonoscopy, or a calcium score scan instead of invasive angiography, can provide meaningful information without compromising your health. Final message: a sincere call to action. Getting older doesn't mean depending on machines, tests, or medications. Your body still has the ability to heal if you care for it the right way. Lifestyle is the strongest form of prevention. Eat simple but nutritious meals. Move your body gently each day. Even a 20-30-minute walk makes a big difference. Sleep well, stay positive, talk more with your loved ones. These are the best medicines, and no hospital can prescribe them. Take charge of your health. Don't let unnecessary tests rob you of the peace you deserve during one of the most beautiful stages of life.